And then there's this. President Trump is hitting the campaign trail. He's doing that as early as tomorrow, perhaps, and that is despite major concerns over his coronavirus diagnosis. His doctor says he's stable and doing well, but it is unclear if he is still contagious after testing positive only last week. We know the president has been receiving an experimental drug cocktail he claims cured him. He claims, but the White House hasn't said when he last tested negative for the virus. However, that is not stopping the president from making plans to hold campaign rallies this weekend, and that is despite being potentially contagious.
I think I'm going to try doing a rally on Saturday night if we have enough time to put it together. But we want to do a rally in Florida, probably in Florida on Saturday night. Might come back and do one in Pennsylvania in the following night, and it's incredible what's going on. I feel so good.
Now, this all comes despite the CDC recommending 2 negative tests 24 hours apart before potentially exposing others. And in some cases, people who become severely ill should also consider isolating for several weeks. Let us bring in Ben Tracy. He is covering all the developments from the White House. Ben, there's so much to unpack here. I mean, I watched David Begnaud do a piece this morning on CBS This Morning where he spoke to people who had recovered even from COVID-19, and they described some of their ongoing conditions. We don't know President Trump's condition other than those very short statements that his doctor releases. He's been tweeting. He's been on interviews. He was just receiving some oxygen and steroid medication antibody cocktails days ago. During one of those interviews, I heard the president, I think it was in your piece, Ben, sort of coughing and wheezing throughout the interview. So what do we know about his condition now?
Well, you mentioned those short doctor's notes. This is the last one that we got. It came out last night. And Dr. Sean Conley basically says the president has completed his course of therapy for COVID. He's stable. He responded extremely well to treatment, and basically says that he can go back to work and doing public engagements on Saturday. We should keep in mind the same doctor said last week that President Trump wouldn't even be out of the woods. They wouldn't breathe a sigh of relief until this coming Monday. And now he's saying that he could go potentially campaign on Saturday. What this note does not say, though, a lot of very important things. Has the president tested negative for coronavirus? Is he still contagious? This doesn't even say what his temperature is. So there's a lot really missing from this. And you mentioned hearing him cough during that Sean Hannity interview last night. He did it several times. So there are some real questions. And we should also remind people that we have not laid eyes on the president other than these produced White House videos since he returned on Monday, since that shot there on the balcony. That's the last time reporters here at the White House actually saw him with our own eyes to be able to assess his condition. He is going to do a live interview tonight on Fox News, apparently, so we'll see how that works, and he's going to do it on camera. So that will at least be some indication of how he's doing. But medically, there are a lot of unanswered questions.
And the other thing we know is that an awful lot of people at the White House have tested positive. Some of them have made public statements. Others, we really only learned through, some really good reporting. So we really have no idea just how many people have been infected. And now we learn that Senate Majority Leader Mitch McConnell said he hasn't been to the White House in 2 months because he thought that the coronavirus protocol there was kind of lax, and more lax than his expectations when it comes to Congress. So what can you tell us about the situation at the White House?
Yeah, that was a bit of a dig from Mitch McConnell. Basically said, I don't think they're handling this well, and they're not serious enough about it. I'm not going to the president's house. That was kind of harsh. But in terms of what's going on here at the White House, you do see more masks. I will say that. As this week has gone on, more and more people in the West Wing are wearing masks, even inside their offices, which is not something you ever saw really before this week. There is social distancing just because there aren't a lot of people here. A lot of the president's staff is either in quarantine, infected with the virus, or they're working from home to avoid getting it. So there's just not a lot of people around, so there is some distance there. But if you want to get a sense of whether or not this has really changed the thought process about the virus and taking precautions, the president's son, Donald Trump Jr., held an event, a campaign event in Florida yesterday, inside, very crowded, very few masks. So it doesn't appear that they've done, a real 180 on their approach to the virus. And the president, when asked about doing these rallies and whether that's safe, his response was, well, I stay very far away from the people. as if it's either about him or him infecting the people, not about the fact that you're bringing a bunch of people together in a crowd not wearing masks, which, if they learned anything from the Rose Garden event for his Supreme Court nominee, simply being outside does not protect you from transmitting the virus.
I mean, you would think that that message would have been driven home, given how many people have been infected in the last couple of weeks, Ben. And look, I know that as a reporter, as a correspondent, as a journalist, that you and all of us from time to time find ourselves in situations that are risky. I know that you've reported from some of the most dangerous places in the world, like North Korea. And yet I am worried about you and the rest of the White House press corps, who is going to have to figure out how to cover this event, should it happen this weekend or even next weekend, without really understanding. I think that the difference, and I don't want to make it too much about journalism, but the difference is that, you know, when you go into a situation like North Korea, or when we find ourselves in places or in countries or in situations that are risk, we have a risk assessment. We know what the risks involved are, and we take precautions for that. Here, it's unclear what the risks are because we're not getting the information from the president's medical team. And so that is troubling, as I wonder how it will look if the president decides to go into a place where not just you, but other Americans are potentially at risk.
Yeah, and we should remind people that when the president decides to travel, that's not a small operation. That is dozens and dozens of people, Secret Service, his staff, journalists. There's motorcades involved. So you have a lot of potential exposure and a lot of people who have to make that risk assessment for themselves as to whether or not they want to do that. And you mentioned just kind of the other people infected here. Part of the problem is we don't really know who is infected. The White House has basically said that unless they determine that you are a close contact of the person, they're just not going to tell you. And we've had at least now 5 people just in the press operation here at the White House who have tested positive, and most of us don't know if we've even come in contact with that person. So there are a lot of unknowns, as this moves along.
Yeah, and we know that their contact tracing process may be a little questionable. We know that Chris Christie is still in the hospital, and he says no one came in contact with him, no one reached out to him, and he was part of the debate prep team for the first debate in a closed room, and he says no one wore masks. But I want to pivot a little bit, Ben. Speaker Nancy Pelosi held a press briefing yesterday, and right at the very end, she mentioned something about the 25th Amendment. We've now learned that she's going to introduce legislation that would create a commission to review whether or not President Trump is fit for office. What can you tell us about this and the president's reaction?
Well, she has accused the president of being in what she calls an altered state. And she seems to be referring to the steroid that the president's been taking, dexamethasone, which is a pretty powerful steroid. She says that what she views, in her opinion, as some of the president's erratic behavior this week, of abruptly pulling out of stimulus talks, of going on some of these, these tweet storms, she's questioning his fitness for office. So she wants to review the president's mental state. I'm not sure. We'll have to wait and see what they actually announce today. This sounds like this could be some politics on the other side of Pennsylvania Avenue. The president obviously not happy to hear this. He basically called her Crazy Nancy and said that she's the one who should be under observation. So we'll see how that plays out when they unveil whatever they're going to unveil on Capitol Hill today.
It's really like all these politicians, it becomes a game of like, Anne-Marie, you have a child. I mean, it's not me, it's her. She's the. Anyway,
yeah.
Ben, there's a lot of back and forth, too, over the future of a stimulus relief bill. President put the kibosh on negotiations. Then he sort of teased that he maybe wanted a standalone bill. Now we're hearing that he may want more. What are you hearing?
Yeah, you need like an Excel spreadsheet or a flowchart to follow this one this week. It's been kind of all over the place. So yes, the president dropped this Twitter bomb earlier this week, basically saying, we're done. I've instructed my representatives to pull out of these negotiations. That surprised everybody, Democrats and Republicans, because the operating assumption here was that the president actually needs this more than the Democrats need it, because he's going into this election in a couple of weeks and he's trailing pretty far behind in the polls. The president then that same night was tweeting about saying, okay, let's do it piecemeal. Let's do some relief for the airlines. Let's do stimulus checks. Mnuchin went back to Nancy Pelosi and said, okay, let's do airlines. And she said, do I need to remind you that we actually did that last Friday, but you guys blocked it? So there was been a lot of back and forth. Now the latest is apparently the president now wants a big deal. He has said, I want to make this deal with Speaker Pelosi. She now is kind of dragging her heels a little bit, and I think at this point knows that she has the upper hand here. And if there's going to be a big deal, it appears she's going to make the president work for it. So this is something that's going to drag into next week, and we should have a pretty good idea by the middle of next week if there really is a deal to be made, or if this is just going to get punted until after the election.
Oh man, the middle of next week for people who are some people are still waiting for their first unemployment checks. That probably feels like 6-7 months away. It sort of boggles the mind that there isn't more of a sense of urgency when there are so many people suffering out there, Ben. But hopefully we get some good news earlier than next week. Thank you so much.
Thank you.